Welcome to a patient's journey guide for total joint replacement. This presentation is for patients having a total joint replacement of the knee, hip, or shoulder. It includes information for all three joints, so you may see some details about a joint you are not having replaced. We share all the information together because much of the education overlaps, with only a few differences that will be explained. Even if you are only having one joint replaced now, one day you might need another, and this education will help you understand the whole process. There are different reasons why someone might need a joint replacement. Let's look at the knee as an example. The knee is the largest hinge joint in your body. It connects your thigh bone, femur, to your shin bone, tibia, and also includes your kneecap, ligaments, and cartilage. Cartilage is the soft cushion that helps the joint move smoothly. In the picture labeled Grade 1, you can see a healthy knee with space between the bones. As people get older, some develop arthritis, which wears down the cartilage. When the bones start rubbing together, like in Grade 4, the space is gone and bone is touching bone. This can be very painful. Old injuries can also damage the knee and make it weak or unstable. A knee replacement means the worn-out bone and cartilage are removed and replaced with special metal and plastic parts that help the joint move better. Your hip is a ball and socket joint that connects your leg bone, femur, to your hip bone, pelvis. Strong muscles and ligaments help keep it stable. Your hip carries your body weight and lets you move in many directions. A smooth layer called cartilage cushions the joint so it can move easily. Like the knee, arthritis or old injuries can cause pain that sometimes makes hip replacement surgery necessary. The shoulder is a ball and socket joint that connects the upper arm bone to the shoulder blade. It is held in place by muscles, tendons, and ligaments, called the rotator cuff. A smooth layer of cartilage covers the joint so it can move without pain. The shoulder helps you lift, reach, and do activities overhead. When arthritis wears away the cartilage, the bones rub together and cause pain. Injuries like rotator cuff tears can also make the shoulder weak and hard to move. If pain becomes severe and affects daily life, a shoulder replacement may be needed. In this surgery, the damaged parts are removed and replaced with metal and plastic pieces to help restore movement. What would be the benefits of surgery? Well, you might experience less pain, better mobility, improved sleep, enhanced quality of life, improved joint function, or a return to everyday activities you once enjoyed. What are some of the risks of surgery? Well, every surgery carries risks. Some of these might include persistent or chronic pain after surgery. You might also experience bleeding during surgery, and you may require a transfusion, though this is very rare. Infection is a potential risk. If an infection occurs, it will require additional treatment, such as antibiotics or possibly more surgery to correct it. You may feel stiffness in your joint. This is typically helped with physical therapy. There is a rare chance of artery or nerve injury. You might also experience a fracture during surgery, but this would be repaired at the time of the procedure. After surgery, your joint may become dislocated. While rare, this does require additional treatment. With hip replacements, occasionally your limb length may change slightly, though this is less common now with the use of computer navigation. After surgery, your wound might heal slowly, which could also require additional treatment. In rare instances, the implant itself can fracture, wear down, or loosen. This would require further treatment, such as surgery to replace or repair the parts. Some individuals might experience blood clots, but these are preventable, and we will teach you how to reduce that risk. Other health issues, such as heart problems, may also occur. Your care team will consist of multiple individuals from many different departments. One is your orthopedic surgeon. This is someone you have already met. They've discussed the reasons why you need a joint replacement. You'll also have a nurse navigator. This individual will help guide you through your joint replacement journey. They will help teach you and your care partner how to stay safe and healthy throughout the process. You will meet members from our pre-admission services clinic, also known as the PASS Clinic. This is a group of individuals you'll see before surgery at your PASS appointment. They will review your medical history and current medications. The nurse practitioner will complete your physical examination and clear you for your upcoming surgery. A member of case management will help create a discharge plan that best meets your needs. They'll also assist with arranging hospital equipment and answering any insurance questions you may have. A member of occupational therapy will help determine the safest way for you to complete daily activities, like bathing and dressing. They'll teach you how to be independent at home. A member of physical therapy will teach you important strength training exercises for both before and after surgery. They'll also show you how to use your walker to get moving after your joint replacement. You will also meet a certified registered nurse anesthetist, or CRNA. A member of this team will evaluate you on your day of surgery and provide personalized care to keep you safe during surgery and recovery. They play a key role in managing your pain. Then, on the day of surgery, you'll meet your surgical team. This team includes registered nurses, RNs, certified nursing assistants, CNAs, and surgical technologists. Your day surgery RN and CNA will admit you to the hospital. Your circulating RN will take you to the operating room, where the surgical technologist will be setting up your room for surgery. These individuals will assist your surgeon during the procedure. After your surgery, you'll return to day surgery and then be discharged home. Choosing a care partner is a crucial step in your recovery journey. This friend or relative will accompany you to preoperative education sessions, provide support during therapy, and help keep you focused throughout the healing process. When selecting your care partner, ensure they are in good physical health, can provide transportation to appointments and surgery, and are able to stay with you for at least 24 hours after surgery and up to 1 week. Your care partner will assist with daily activities, such as bathing, dressing, and bathroom needs, help with position changes, like sitting to standing or getting out of bed, support pain and medication management, and ensure you follow your surgeon's instructions. They will also encourage and help you perform your prescribed exercises and respect any restrictions. Beyond practical support, your care partner will help you stay on track with your recovery goals, reinforce proper exercise techniques, serve as a second set of ears for important information, and be your biggest advocate as you work toward regaining independence. To promote the smoothest and safest recovery, it is important to stop smoking, vaping, and all nicotine use at least 4 to 6 weeks before surgery, and to avoid restarting for at least 4 weeks afterward. Quitting before surgery can reduce your risk of complications by up to 50%. Smoking and nicotine use decrease the oxygen levels in your blood, constrict blood vessels, and limit blood flow to the surgical site, which slows healing. They also increase anesthesia risks, breathing problems, and raise the likelihood of infections, blood clots, poor wound healing, and longer hospital stays. The benefits of quitting include faster healing, fewer complications, improved heart and lung function, less pain, and better overall outcomes. To successfully quit, set a quit date at least 4 to 6 weeks before surgery. Talk to your doctor about medications or nicotine replacement therapies like patches or lozenges. Seek support through quit lines, apps, or counseling, and remove triggers by clearing out smoking or vaping items and avoiding environments where others smoke. What you eat and how you treat your body in the weeks leading to surgery can impact how well and quickly you heal. A little preparation now can make a big difference in recovery later. A well-balanced diet consists of making half your plate fruit and vegetables, a quarter of your plate grains, and a quarter protein. Eat a diet rich in iron, vitamin C, and calcium. Avoid alcohol, especially in the 48 hours before surgery. If you are diabetic or on any type of restricted diet, you should consult your doctor prior to changing your diet regimen. Protein is essential for repairing damaged tissues after surgery, fighting infections, and producing collagen to support tissue growth. It's important to include protein with every meal to aid your recovery. Iron is necessary for building red blood cells, while vitamin C enhances iron absorption. Since some blood loss is expected during surgery, maintaining adequate levels of both iron and vitamin C will help replenish red blood cells. Recommended foods to add to your diet for these nutrients include eggs, nuts and seeds, steak, cheese, chicken breast, Greek yogurt, roasted turkey, broccoli, salmon, tuna, spinach, shrimp, kiwi, pork, oranges, beans, strawberries, peanut butter, and tomato juice. Calcium is a vital mineral necessary for building new bone and maintaining the strength of existing bone. Vitamin D plays a crucial role by helping your body absorb calcium and regulate its levels in the bloodstream. During joint replacement surgery, the damaged bone is removed and replaced with an implant. Over time, new bone will grow around parts of the implant, helping to stabilize it. A diet rich in calcium and vitamin D supports this bone growth process. In addition to bone health, calcium and vitamin D also aid nerve communication, immune system function, and blood flow. Foods recommended for boosting calcium and vitamin D intake include almonds, salmon, tuna, mushrooms, milk, orange juice, sardines, tofu, and yogurt. Complete your pre-surgery requirements to help ensure a successful total joint replacement journey. Attending the virtual Total Joints class is a valuable step in preparing you for surgery and recovery. Be sure to attend your pre-admission screening, PASS appointment, to complete your preoperative evaluation. A healthy heart is essential. If your EKG shows abnormalities or you are taking anticoagulants, you may need clearance from a cardiologist. If you are immunocompromised or taking immunosuppressive medications, consult your doctor to manage these safely before surgery. Maintaining healthy teeth is important to reduce infection risk. If you have loose, broken, or infected teeth, dental clearance will be required, so follow all instructions provided during your dental screening. Finally, controlling your blood sugar supports better healing. If your A1C is above 7.5, your surgeon will refer you to your primary care provider for stabilization prior to surgery. Start your preoperative exercises now to promote a faster and easier recovery. Select positions, lying, sitting, or standing, based on what feels comfortable and manageable for you. You may experience mild discomfort, but stop any activity if your pain increases. Stretch slowly and with control. And for hip and knee patients, be sure to exercise both legs to maintain balanced strength. Incorporate light endurance activities, such as walking for 10 to 15 minutes daily while wearing flat, supportive shoes. Avoid any exercises that cause pain to prevent injury. Staying safe and avoiding falls is essential during your recovery. Wear well-fitting shoes or socks with non-slip grips to prevent slipping. Clear all walkways of loose wires, cords, and clutter, making sure paths are wide enough for your walker if you are discharged with one. Remove sliding rugs and secure any carpets to the floor. If you have slippery surfaces, cover them with non-movable rugs and fix any uneven flooring. Improve lighting throughout your home and use night lights in hallways and dark rooms to increase visibility. Be mindful of pets and keep them out of your walking path. If you are a hip or knee patient, avoid carrying items while using a walker. Use a walker basket instead. Finally, be sure to complete the home safety checklist to ensure your environment is fully prepared for a safe recovery. Preparing your home before surgery is an important step in ensuring a safe and smooth recovery. Start by addressing flooring and obstacles. Keep walkways clear of rugs, cords, and clutter. Use non-slip mats and fix any uneven flooring to prevent falls. For furniture and layout, use sturdy chairs with armrests and arrange furniture to allow easy access to the bathroom, kitchen, and bedroom. In the bathroom, install grab bars near the toilet, shower, and tub. Use non-slip mats and a shower chair, and consider adding a raised toilet seat. Focus on lighting by ensuring bright light in key areas and enhance safety with motion sensor lights and night lights. When it comes to assistive devices, make sure your walker or cane fits properly, is within easy reach, and that you've been shown how to use it correctly, or your sling fits appropriately. Finally, for stairs and steps, install sturdy handrails on both sides and mark the edges of steps with contrasting tape for visibility. For emergency access, keep a phone within reach at all times and post emergency contact numbers in clearly visible locations. In your bedroom, adjust the bed height to allow for easy transfers, and place a sturdy chair nearby or install a grab bar for added support. In the kitchen, organize daily use items within easy reach. Clear any obstacles near the stove and prepare meals in advance to reduce strain. Designate an exercise area by clearing a safe, open space and commit to a regular therapy schedule to support your progress. For caregiver support, make sure a trained care partner is available to assist with your needs. Lastly, ensure environmental comfort by maintaining good airflow and a comfortable room temperature to promote rest and healing. 7 days before surgery, you should stop taking certain herbal supplements, including fish oil, turmeric, garlic, ginseng, ginger, vitamin E, and ginkgo biloba. Additionally, if you use GLP-1 medications, such as Bydureon, Trulicity, Mounjaro, Ozempic, Wegovy, or Rybelsus, you will also stop these 7 days prior to surgery. If you take insulin diuretics, water pills, anticoagulants, or antiplatelet medications, the pre-admission screening nurse practitioner, PASS-NP, will provide specific instructions on how to manage these before your procedure. Any other medications you take will be reviewed and addressed during your PASS appointment to ensure your safety and optimal preparation for surgery. Preparing your skin for surgery is an important step you can take to help prevent infections. Beginning 4 nights before your procedure, you will follow a specific cleansing routine using the CHG, chlorhexidine gluconate solution, and the provided shower mitt. Start by rinsing your body with warm water and washing your hair with regular shampoo. Turn off the water, wet the mitt, and use half the CHG bottle to scrub your body below the chin. Avoid your eyes, nose, mouth, and ears. Pay special attention to your surgical site, scrubbing firmly, and then wait 3 minutes before rinsing off completely. Dry with a clean towel, dress in clean clothes, and sleep in fresh sheets. You will repeat this exact process 3 nights, 2 nights, and the night before surgery, always using a clean towel, clean clothes, and fresh bedding. On the morning of surgery, repeat the same steps, using a clean towel and dressing in freshly laundered clothes. Important reminders: do not apply lotions, creams, powders, deodorant, or hair conditioner after your final shower. If you are allergic to CGH, discontinue use and switch to regular soap. Notify your doctor if you experience any irritation. Also, do not shave the surgical site. A day surgery nurse will call you prior to your procedure to review important preoperative instructions. During this call, you will be told what time to arrive at the hospital and when to stop eating, drinking, and using gum, candy, tobacco, or smoking products. The nurse will also go over which medications you should take 2 hours before your arrival and confirm that you have a ride home and someone to stay with you after surgery. Instructions on how to properly use a special CHG soap for your pre-surgery showers, beginning 4 nights before and again the morning of surgery, will also be discussed. You will be reminded to bring your walker if you are a hip or knee patient, wear loose and comfortable clothing, and to leave all jewelry, piercings, and valuables at home. 1 adult visitor may stay with you before surgery, If you begin to feel sick prior to your scheduled procedure, call 541-667-3404 to cancel. If you have been seen by urgent care or the emergency room in the days leading up to your surgery, please let the day surgery nurse or nursing supervisor know. Please note that if you are a woman of childbearing age, a urine pregnancy test will be performed upon arrival. Drinking extra carbohydrates before surgery helps your body better manage the stress of the procedure, supporting a smoother recovery and improved overall outcomes. As part of your preparation, you will drink 1 bottle of Ensure pre-surgery the night before your procedure. On the day of surgery, drink a second bottle exactly 4 hours before your scheduled surgery time. If you are diabetic, you will still follow this protocol as long as your A1C is below 7.0. On the day of surgery, bring a few important items to help ensure a smooth and comfortable experience. Most importantly, come with a positive attitude. Wear or pack loose, comfortable clothes to change into for your trip home. If you use a CPAP machine, bring your mask and a copy of your current settings. Have the phone numbers of any family or friends you may want to contact during your stay. For hips and knee patients, don't forget your walker, as it will be needed for safe mobility after surgery. If you have advanced medical directives, bring a copy with you. This may include a living will, which outlines your wishes if you're unable to communicate, a healthcare agent designation, naming someone to make medical decisions on your behalf, and healthcare instructions, which detail your preferences regarding life support, hydration, nutrition, and pain control. Do not bring your home medications or any valuables to the hospital on the day of surgery. This includes purses, wallets, money, and jewelry. Keeping these items at home helps ensure they are safe and not misplaced during your stay. On the day of surgery, you'll encounter several pieces of special equipment designed to support your safety, comfort, and recovery. An IV line will be placed in your hand or arm to deliver fluids, medications, and anesthesia. You'll wear sequential compression devices, SCDs, soft leg wraps that gently squeeze your legs to improve circulation and help prevent blood clots. A stretcher or rolling hospital bed will be used to safely transport you before and after surgery. Near your bed, a call light will be available so you can easily request assistance at any time. You may also wear TED hose, tight compression stockings that improve circulation and reduce the risk of blood clots. Be sure to follow your surgeon's instructions regarding their use. To help maintain a stable body temperature, you'll be covered with a bear hugger gown, a warming gown that gently blows warm air. Finally, for hip and knee patients, you will have your walker to help you move safely after surgery, and physical therapy will guide you in learning how to use it correctly. On the day of surgery, your anesthesia and pain management plan will be tailored to your needs by the anesthesia team, who will recommend the safest and most effective option based on your health and the type of procedure. Common types of anesthesia include regional anesthesia, which numbs a larger area of the body, such as with a spinal block or nerve block. General anesthesia, which puts you completely to sleep during surgery, and local anesthesia, which numbs only the area around the surgical site. Your anesthesia provider will explain the risks and benefits of each option and answer any questions you may have. Some patients may experience nausea or vomiting after anesthesia. Medications are available to manage these symptoms if they occur. Managing your pain after surgery is essential for a safe and comfortable recovery. While we don't expect you to be completely pain-free, your pain should be manageable. To help guide treatment, we use a pain scale from 0 to 10, where 0 means no pain and 10 is the worst pain you can imagine. Your care team will routinely ask you to rate your pain and will adjust your treatment as needed. It's important to let your team know if your pain becomes intolerable, if you feel nauseous, or if you're more sleepy or confused than expected. Open communication allows us to provide the best care possible. Your comfort and safety are our top priorities. Tranexamic acid, or TXA, is a medication used during total joint replacement surgery to reduce bleeding by supporting your body's natural clotting process. Because this type of surgery can cause significant blood loss, TXA helps minimize bleeding, lowers the need for blood transfusions, and promotes a faster recovery. TXA may be given orally as a tablet before surgery, through an IV during surgery, the most common method, or applied directly to the surgical site. Your surgical team will decide the best option for you. TXA is generally safe for most patients and has been widely used worldwide for many years without increasing the risk of blood clots. However, you should inform your healthcare team if you have a history of blood clots, such as deep vein thrombosis or pulmonary embolism, stroke, heart attack, kidney problems, seizures, or any medication allergies. Rare side effects can include nausea, vomiting, headache, or very rarely, seizures, usually associated with high doses. If you experience any unusual symptoms after receiving TXA, be sure to notify your care team. It's important to know that TXA is a part of a comprehensive approach to make your surgery safer and your recovery smoother, alongside standard measures to prevent blood clots, such as blood thinners and early mobilization. Your care team will collaborate closely with you and your family to develop a personalized discharge plan tailored to your recovery needs. This team typically includes physical and/or occupational therapists, PT or OT, nursing staff, and, if needed, a case manager. Most patients are discharged on the same day as their surgery, though a small number may require 1 or more nights in the hospital. Your specific discharge timing will depend on your progress, mobility, available support at home, and overall medical condition. To ensure a smooth and safe discharge home, please keep the following points in mind. A responsible adult must drive you home after surgery and stay with you for the first 24 hours. On surgery day, have your driver's name and phone number ready for your care team. If you do not have a ride or someone to assist you at home, contact your surgeon's office immediately, as your surgery may need to be rescheduled. You will receive detailed discharge instructions covering medications, therapy, activity guidelines, and follow-up care. Be proactive in filling any prescriptions provided during your pre-op visit before surgery. Additionally, arrange for any necessary home equipment, such as an elevated toilet seat, prior to your surgery day. Finally, understand your therapy plan. Whether you will attend outpatient therapy or receive home health services to support your recovery. If recovering at home is not suitable, it's important to plan for alternative post-discharge care options, such as a rehabilitation center or skilled nursing facility. In these cases, transportation will need to be arranged, and a member of the case management team can assist with coordinating these logistics. Nursing staff will ensure all necessary transfer paperwork and medical orders are completed to support a smooth and safe transition to your next level of care. Medication reconciliation is a key part of your discharge process to ensure your safety and a smooth transition home. Before you leave the hospital, your care team will conduct a thorough review of your medications. Your post-operative discharge instructions will include an updated medication list that clearly indicates which medications to start, continue, adjust, or stop. If you have any questions or concerns about your medications after discharge, don't hesitate to contact your care team. They are there to help you manage your recovery safely and effectively. Before going home, make sure you have the special equipment you'll need. For hip and knee patients, this includes a walker, which will be sent home with you. For shoulder patients, this includes a sling to support and protect your arm. To support your recovery, a series of post-discharge follow-ups are planned. You will receive detailed discharge instructions. Keep these documents handy, as they will guide you throughout your recovery. Expect a follow-up call from the nurse navigator the day after surgery, along with a call from our day surgery team within 1 to 2 days after your procedure. Your first post-operative appointment with your surgeon will take place around 2 to 3 weeks after surgery, followed by a 6-week visit to assess your healing and mobility. A final check-in at the 1-year mark will help evaluate your long-term recovery and surgical outcomes. Breathing exercises are an important part of your recovery after total joint surgery. Deep breathing helps keep your lungs clear, improves oxygen flow, and reduces the risk of complications like pneumonia, especially after anesthesia and limited mobility. Breathing exercise. Breathe in deeply through your nose. Hold your breath for 5 to 10 seconds. Slowly breathe out through your mouth as if blowing out a candle for 10 to 20 seconds. Repeat this 10 times. Coughing exercise. Take a slow, deep breath in through your nose and exhale through your mouth. Take another breath in, hold it briefly, then cough firmly as you exhale. Repeat this 2 times. Incorporate these exercises several times a day after surgery to support healthy lung function and aid your overall recovery. Some individuals might receive an incentive spirometer. Using an incentive spirometer is an important part of your recovery after total joint surgery. Regular use keeps your lungs active and clear, supporting a safer, smoother recovery. How to use it. Sit up straight. Hold the spirometer upright in front of you. Place the mouthpiece in your mouth and seal your lips tightly around it. Take a slow, deep breath in, like you're sucking through a straw, and try to raise the ball or piston to the smiley face. Hold your breath for 3 seconds. Remove the mouthpiece and breathe out normally. Rest briefly, then repeat 10 times every hour while you're awake. Helpful tips. Try to cough after using the spirometer to help clear your lungs. Ask a caregiver or family member to remind you to use it frequently. Consistent use of the incentive spirometer is a simple but powerful tool to protect your lung health and aid in your overall recovery. Proper wound care is essential for preventing infection and promoting healing after total joint surgery. You may shower with your waterproof dressing in place. If the dressing begins to loosen after 5 days, it can be removed, and you may continue to shower without it. However, avoid submerging your incision in water. No baths, soaking, or hot tubs until it is fully healed, which may take up to 6 weeks. If your incision is covered with surgical glue, mesh, or steri-strips, leave them in place. They will naturally fall off or dissolve over time, so do not pick at them. Monitor the incision closely for signs of infection, such as increased drainage, redness, pain, foul odor, or warmth at the site. If you notice any of these symptoms, contact your surgeon right away. To help prevent infection, wash your hands frequently, especially after using the bathroom or handling pets. If you develop a fever over 101.4 degrees Fahrenheit, notify your surgeon. If you have any concerns about your incision or recovery, don't hesitate to reach out to your surgeon's office. Early attention can help ensure a safe and smooth healing process. The ice therapy machine helps reduce pain and swelling after surgery by delivering targeted cold therapy. Use the machine for 20 minutes every hour while awake, continuing for 48 to 72 hours after your operation. Do not use the machine while sleeping to avoid skin injury. Always check your skin for redness, numbness, or blisters during use, and never apply the cold pad directly to your skin. Always use a barrier like a cloth or towel. Contact your healthcare provider if you experience increased pain, swelling, numbness, or if you encounter any problems with the equipment. In some cases, your surgeon may decide to use a wound vacuum device to aid healing. This device is worn quietly and continuously for up to 7 days, with no dressing changes needed during that time. It is important not to remove or tamper with the dressing or tubing, and never ignore alarms from the device. You should keep the device on 24 hours a day, 7 days a week. Ensure the tubing remains clear, and charge the device nightly. Monitor the surgical site closely for swelling, redness, pain, or drainage. Contact your healthcare provider immediately if alarms persist, signs of infection develop, the dressing becomes loose, your pain worsens, or if the device loses suction for 2 hours or more. Managing pain effectively at home is key to preventing the pain cycle, where discomfort worsens if left untreated. It's important to take your pain medications about 30 to 45 minutes before exercise or therapy to stay ahead of the pain. To help relieve pain, try relaxing by listening to calming music and changing positions frequently to reduce stiffness. Applying cold therapy with ice for 20 minutes every hour while awake and elevating the affected area above your heart can also reduce swelling and discomfort. Non-drug methods, such as deep breathing, taking rest breaks, moving slowly and controlled, and staying gently active, support your healing process. Always use over-the-counter or prescription pain medications as directed by your healthcare provider to safely manage your pain. For hip and knee patients, to reduce swelling and discomfort after surgery, keep your leg elevated above heart level by placing pillows under your ankle. This helps fluid drain away and decreases swelling. Apply ice for 20 minutes every hour while awake, always using a cloth between the ice and your skin to protect it. Wear any prescribed compression garments as directed to further minimize swelling. Engage in gentle activity, such as short walks, to improve circulation, but avoid overexerting yourself. Follow your physical therapist's guidance by performing recommended exercises to maintain range of motion and build strength. Staying well hydrated by drinking plenty of water also supports healing and reduces swelling. Take your pain relievers and anti-inflammatory medications as prescribed, and avoid staying in one position for too long by changing positions every 30 to 60 minutes to prevent fluid buildup. After shoulder surgery, you can reduce swelling and discomfort by keeping your arm at or just above heart level with pillows under your elbow and wrist, not the shoulder. Use a cold pack for 20 minutes at a time, every hour while awake, with a towel barrier on your skin. Always wear your sling or immobilizer as directed, and only remove it for approved activities. Move gently. Take short walks, and do only the exercises your surgeon or therapist allows. Stay hydrated. Take medications exactly as prescribed, and change positions every 30 to 60 minutes while keeping your arms supported. Following these steps, along with your physical therapy plan, will help you heal safely and comfortably. To help prevent nausea after surgery, avoid common triggers such as car rides, alcohol, strong smells, and overeating. Early interventions can be effective. Try light walking, staying well hydrated, using cool cloths on your forehead, aromatherapy, acupressure bands, or taking prescribed anti-nausea medications. Taking pain medications with a small snack can also reduce stomach irritation. When possible, use non-opioid pain relievers alongside non-medication strategies to help minimize nausea and improve comfort during your recovery. To prevent constipation after surgery, drink 6 to 8 glasses of water daily and eat a diet rich in high-fiber foods, such as fruits, vegetables, and whole grains. Stay as active as possible by walking frequently within your limits. Reduce the use of narcotic pain medications as soon as your provider advises. Use stool softeners or laxatives as directed by your healthcare team, and avoid caffeine, which can sometimes worsen constipation. If constipation does occur, try natural remedies like prune juice or dried fruits. Milk of magnesia can also be used if needed. Be sure to follow the instructions carefully. After surgery, bruising is common and usually fades within 1 to 3 weeks. For hip and knee surgery, bruising may appear on the hip, knee, leg, or foot. For shoulder surgery, it can show up on the shoulder, upper arm, chest, side, or even down to the elbow. To help it heal, use ice. Keep the area elevated. Take your medications as directed, and wear compression stockings if your care team recommends them. After surgery, preventing blood clots is crucial for your safety. Take your prescribed blood thinners exactly as directed by your healthcare provider. Perform ankle pumps, flexing your feet up and down about 10 times every hour while awake, and aim to walk several times each day to promote circulation. If advised, wear compression stockings and keep your leg elevated to reduce swelling. Report any major bleeding, unusual bruising, dizziness, chest pain, or difficulty breathing to your care team immediately. While taking blood thinners, avoid starting new medications or drinking alcohol without your provider's approval, and steer clear of activities that increase your risk of injury. Maintain a consistent intake of vitamin K-rich foods like dark leafy greens, and delay dental procedures unless your surgeon clears you. Be alert for signs of blood clots, including persistent swelling, pain, warmth or tenderness in your leg, as well as chest pain or shortness of breath. If you experience a fall, contact your surgeon right away. For hip and knee patients after surgery, it's important to follow specific precautions to support healing and avoid complications. Avoid strenuous exercise, heavy lifting, or extreme joint movements until your surgeon gives you clearance. Protect your incision by keeping pressure off the area and avoiding dirty or risky environments. To prevent falls, use your assistive devices as recommended and ask for help when needed. Do not drive while taking narcotic pain medications or until your reaction time has fully returned to normal, which may take 4 to 9 weeks. Avoid long car rides for at least 6 weeks and postpone air travel for 90 days. Additionally, delay any non-urgent dental work for 3 months to reduce infection risk during your recovery. After shoulder surgery, it's important to follow certain precautions to support healing and prevent complications. Avoid lifting, pushing, pulling, or reaching overhead with your surgical arm. Protect your incision by keeping pressure off the area and staying away from dirty or risky environments. To reduce your risk of falls, use assistive devices as recommended and ask for help when needed. Do not drive while taking narcotic pain medication or until your reaction time has fully returned to normal, which may take 4 to 9 weeks. Avoid long car rides for at least 6 weeks and postpone air travel for 90 days. In addition, delay any non-urgent dental work for 3 months to lower the risk of infection during your recovery. After surgery, problems can sometimes happen. Early problems may include infection, blood clots, bleeding, or wound healing issues. Rarely, nerves or blood vessels may be hurt. Later on, some people may have stiffness, pain, looseness of the joint, or issues with the kneecap. The new joint can also wear out over time or grow extra bone around it. Other health problems, like heart or lung issues, bladder infections, or confusion in older adults can also occur. Your care team will tell you what signs to watch for and how to stay safe. Call 911 immediately if you experience chest pain, difficulty breathing, or fainting. Also seek emergency help if you have sudden weakness, numbness, slurred speech, severe bleeding, or a rapid, irregular heartbeat. These symptoms could indicate a serious condition such as a hemorrhage, heart attack, stroke, or pulmonary embolism and require urgent medical attention. Contact your surgeon at any time, even after hours, if you experience increased redness, warmth, or drainage at your incision site, a fever over 101.4 degrees Fahrenheit, chills or night sweats, worsening joint pain, new swelling or calf tenderness, difficulty walking, or new joint instability. For routine questions during office hours, such as concerns about medications, rehabilitation, equipment, or follow-up care, you can reach out to the office. Mild swelling, bruising, or a saturated dressing, see Figure 3, as well as mild warmth without other signs of infection can typically be managed with your care team during normal hours. The hospital is available 24/7 at 541-667-3404 for urgent concerns. Keep your discharge instructions handy and write down your symptoms before calling. When in doubt, don't hesitate to contact us. We're here to help. It's normal to experience sleep difficulties after surgery due to factors like anesthesia, stress, and changes in your daily routine. To improve your sleep, try to avoid daytime naps and limit caffeine intake after mid-afternoon. Listening to calming music before bedtime can help you relax, and taking a warm shower, if your care team has approved it, may also promote better rest. Be patient with yourself. as sleep typically improves within a few weeks as your body heals. During recovery, it's normal to experience some temporary changes in your body. You may notice a reduced appetite, which typically improves as healing progresses. Be sure to stay hydrated by drinking plenty of water each day. Low energy levels are also common and can last for up to 4 weeks. These changes are part of your body's natural healing process, so give yourself time and patience as you recover. Please refer to the joint-specific videos for exercises and dressing aids. While general precautions are listed in your patient education book, your specific precautions may differ. Always refer to your after-surgery discharge instructions for the most accurate and personalized guidance. Frequently asked questions. Will I need a walker, crutches, or a cane? For hip and knee patients, yes, you'll likely need help walking at first. Most people use a walker to stay safe and avoid falling. After recovering for a period of time, most people transition to using a cane for assistance. Do I have to buy a walker? Your insurance will be billed for your walker. You will need to pick up your walker and bring it with you to the hospital. How long will I need to use my walker or cane? Every individual heals and recovers at a different rate. You will use your walker or cane until you feel stable while walking and going up and down stairs. How long will my new joint last? Can it be replaced again? Joint implants usually last 10 to 15 years, but some last 30 years or more. How long yours lasts depends on things like your age, weight, activity level, and overall health. If the implant wears out or causes problems, it can often be replaced with another surgery. Who do I contact if I need help? For life-threatening emergencies, call 911. For all other issues, call your surgeon's office during business hours or the hospital after hours at 541-667-3404. They will get you in touch with your surgeon. What determines if I get a wound vac? Your surgeon will determine your risk factors prior to surgery. If they feel it's necessary, they will go over this with you. On rare occasions during surgery, your surgeon may determine you will benefit from a wound vac. How long and where will my scar be? The scar size and location depends on how your surgery is done. You might feel some numbness around the scar after it heals. Talk with your surgeon about what to expect. I'm allergic to nickel. Will that be a problem with my joint implant? Most orthopedic implants do contain small amounts of nickel. However, the nickel is typically bound in such a way that it doesn't leach out significantly into the body. Most patients with a self-reported nickel allergy, like from jewelry, do just fine and have no reaction at all. If your reaction to nickel has ever been severe, like blistering, systemic rash, or a diagnosed metal allergy by an allergist, we can work with your surgeon to evaluate further. In some cases, they may recommend allergy testing or consider implant options with lower nickel content. Ultimately, the surgeon will make the best decision based on your allergy history and overall health. Be sure to mention this during your pre-op visit so it's documented and assessed thoroughly. This concludes a patient's journey guide for total joint replacement. Thank you for choosing Good Shepherd. We look forward to providing you with exceptional care.